Hi, my name is Kerry Wyer. I'm a speech pathologist and registered teacher. Recently I screened the children in prep at your child's school. Screening was an individualised screening where I spent 15 minutes with each child in a one-to-one situation. The results of the screening will be given to your child's classroom teacher. The teacher will be meeting with you to discuss the results. The session was quick, full of fun activities that the children seemed to really enjoy. The screening was done to flag children who may require further in-depth assessment. The screening does give us a standardised score for comparison with peers, but it does not give us a diagnosis. It does not identify the strengths and weaknesses of your child in relation to language. And there may be things that we've missed as well. So as a child's parent, if you are still concerned about your child's speech and language development, please mention it to the classroom teacher, and I'm sure that we'll be able to help you out with further investigation if that's necessary. The reason for the screening, early detection of any speech and language difficulties, may help influence your child's learning at school. Speech and language difficulties may influence the student's learning at school, particularly in the areas of reading, spelling, comprehension and written expression. I looked at a variety of areas when I was screening your child. The first area that I looked at was their receptive language skills. The next was their expressive language skills, and then I moved on to assess their articulation, their connected speech, their voice, and to see if there are any stuttering issues. So let's start with the first one, the receptive language skills. Receptive language is the process of understanding what's being said. Some children may be able to attend visually for long periods, but are inattentive and restless in listening situations. I see this scenario so often in the clinic where I work, where there'll be children who'll be able to concentrate in the waiting room doing jigsaw puzzles and visual activities, and when they're required then when they come into the clinic to do some listening activities where there's no visual component to the activity, the children may sometimes find that quite challenging just to be listening without any visual content. The children took part in activities where they were required to listen and then follow through on the instruction. So I might give them an instruction, say put the button on the chair or put the button under the box, and then throughout the screening then the instructions became more difficult as we went along. The skills required for receptive language or for understanding are skills like attention, being able to attend to what the person is saying, memory, remembering what's being said, vocabulary skills, and syntax, the understanding of the grammar of the sentence. And just going back to that area of memory, recently I had a child who attended in the clinic where the mother was saying that the child was getting very, very upset when she was talking to her about her behaviour. The parent had been discussing with the child the ramifications of bad behaviour and saying, you know, if you do this and this and this, then I will put you in the naughty corner or the timeout corner. And all that child was able to remember of that discussion with the parent was, I'll put you in the naughty corner, and the child was getting very upset and they were really getting nowhere with their discussions about behaviour. And that was mainly because of the memory issue involved for this child. Red flags of poor receptive language is a child who's apparently cooperative but doesn't follow directions. They may follow the lead of others in the classroom, so when the teacher gives an instruction, they may look to see what the other children are doing in the classroom and follow what they're doing blindly, as they have no idea what's expected of them. Or they may ask a peer what they're supposed to be doing. The sort of child who may take extra time to process the direction, so you may even hear them sometimes repeating back what they've been asked to do. The child who remembers only part of a long instruction, or the child who, when they get home from school, are exhausted because they've been so tired from trying to listen all day, and the listening is very hard for them. It's a very tricky skill for them. They may also tune out in the listening situation and just, you know, not even try to concentrate because it's all too difficult for them. Strategies for improving receptive language: make sure that you have your child's attention. Keep background noise to a minimum. So that when you're doing things like homework and things like that, make sure that the television is turned down and that the radio isn't on so that they can hear quite clearly, because sometimes some children have difficulty listening against background noise. Say less when you're talking to them. Stress important words. Slow down the rate of your speech. And the use of visuals to assist with listening is often very helpful for them as well. Now, we've looked at receptive language in some detail, and that's the first area that I looked at with the child in the screening. The second area that I looked at was the area of expressive language. Expressive language is the way a child conveys a message verbally. The children were shown pictures in the screening and asked to describe what was happening in the picture. And I wrote down what each of the children was saying in response to that, and that language sample has been given to your child's teacher. So that possibly later on during the year, the teachers may find that quite a helpful tool for them just to compare and see how much your child's improved. The red flags of poor expressive language are if the child uses poor grammar, speaks in short sentences, the stories that they tell you can be disjointed or poorly sequenced. There's the sort of child that may have a lot to say, but the listener may be quite confused about the message they're trying to deliver. Sometimes children with expressive language have difficulty getting to the point of what they're saying. The child who may have trouble finding the exact word that they want to use, or there may even be some children where they use gesture to assist with their communication. Strategies for improving expressive language: be a good language model. Talk about what you're doing as often as you can, as much as you can with your child. Use what your child already knows and expand on that. Add relevant information to what your child is saying. So for example, if your child has said, "It's hot today," you could respond by saying, "Yes, it is hot today. I like this kind of weather." And that way, by introducing that new vocab word of weather, is going to expand your child's vocabulary. Model the correct form for your child. If the child says incorrectly, "I go to the beach," then as the adult you could respond by saying, "Yes, I went to the beach too. I went to the beach for a swim." Some parents will respond to the child when they say "I go to the beach" by saying, "Oh, that's not right. You don't say "I go to the beach." And really the child's learning nothing from that interaction at all. A couple of the children that I saw had English as a second language. If you feel that your child has weaknesses in their first language, then I would recommend that you seek the help of a speech pathologist. Otherwise, an ESL teacher should be the one who's able to help you out there in that situation. So we've looked at receptive language, expressive language, both the components of the screening test. The next area that I screened as well was the area of articulation. Articulation is the ability to be able to say sounds correctly. Errors usually follow a predictable pattern. So it may be acceptable for a 3-year-old to say "wabbit" for rabbit, but this error would not be acceptable for a 5-year-old or older. Children with articulations are at risk of having problems with literacy acquisition, so it's always a good idea to get help sooner rather than later. The next area that I looked at, so it was receptive language, expressive language, articulation. I looked at the area of connected speech. And connected speech is the ability to be able to speak intelligibly in conversation. Some children may be able to say words clearly in isolation, but their connected speech may be difficult to understand. So I've marked that on the screening form that you'll be receiving. The next area that I looked at was the area of stuttering. Stuttering deals with the fluency of speech. Children who stutter may repeat sounds or words. They may have prolongations of vowels, hesitations or pauses in their speech. And it's always wise to seek the guidance of a speech pathologist if you feel that your child may have difficulties with stuttering. The program considered best practice in Australia is the LIDCOM program. So we've looked at receptive language, expressive language, articulation, connected speech and stuttering, and now moving on to the area of voice. When I looked at voice with your child, I was looking at the quality of their voice, and that is often related to their vocal fold function. You may find that a child who screams or yells a lot in the playground may have a hoarse or harsh voice, and that will be the area that I would be looking at to assist with your child. Now, an area that I have not looked at with your child that I'm sure will come up quite soon in the prep year will be the area of phonological awareness. I didn't address this area or look at this area because some of the skills that I would have looked at have not been learnt by the children in classes yet. So I'm sure that the teachers will be well aware of phonological issues and will be able to point these out to you if your child is having trouble in this area. Phonological awareness is a powerful predictor of success in learning to read or spell. The red flags of poor phonological awareness skills is a child who's slow to learn sounds and letter names. They may be unable to make up a list of rhyming words. They may have difficulty analysing spoken words into syllables or sounds, or they may confuse similar sounding words in speech or in spelling. For example, confuse cone with cone or speech with peach. Strategies for improving phonological awareness skills. It's important for your child to know the names of the letters, but even more important than that is for your child to know the sounds that the letters are making. And I'm always a big believer in teaching oral awareness of where the sounds are being made in the mouth to assist the child in learning the sounds that the letters are making. It's important to teach them to break words into syllables, to learn rhyming, and to be able to blend sounds together to make words. So by that I mean if you've got a word like cat, being able to know that k-at makes the word cat, or ilk makes the word milk. Segmenting is also another important phonological skill, and that's the opposite of blending, where we take a word and break that word up into its individual sounds. So a word like moon would be ooh, So that would be breaking that word up or segmenting that word up into its sounds. Children require excellent sound analysis skills to become successful at reading and spelling. So the next area that I'll mention as well is just the area of hearing. If your child has difficulty with articulation or language skills, one of the first things that I would suggest would be to have their hearing checked, and that always would need to be done by an audiologist. Just before I finish off now, I was going to mention the area of neuroplasticity to you. Neuroplasticity is the brain's ability to reorganise neural pathways based on new experience. As we learn things, the brain changes. The first 7 years of life are known to be the time when most structural and functional change or neuroplasticity occurs. So these first 7 years that we have with your children are really a wonderful window of opportunity to make real change for your child. Early intervention is predicated on the idea that by fostering a set of skills early in life, later difficulties will be reduced or even eliminated. So remember, the earlier that you seek help if you think there's an issue, the earlier the better. If you're concerned by anything that I've mentioned to you today, seek further assistance or make your teacher aware that you are concerned about your child's speech and language skills. Thank you.